You're watching TV9 News and I'm Prajwal D'Souza. Even as the country is battling the second wave of COVID-19, a relatively slowed down vaccination drive has stirred a cause of worry. Although new cases are not increasing in the same rate it used to do a couple of weeks ago, on the vaccination front, the news does not look so good. Let me first tell you about the number of doses the two main vaccine manufacturers, which are Serum Institute of India and Bharat Biotech, are manufacturing. According to a Times of India report, the central government has told the Supreme Court that the Pune-based SII was manufacturing nearly 6.5 crore doses of Covishield a month, while Bharat Biotech was manufacturing nearly 2 crore doses of its indigenous vaccine Covaxin in a month. Now, by the end of July, the manufacturing would be ramped up to 5.5 crores a month for Covaxin. The government is also expecting the recently approved Sputnik 5 to increase its manufacturing capabilities from 30 lakh to 1.2 crores a month by July. Currently, as Covishield and Covaxin are being administered, let us only look into vaccines. If we combine the average doses manufactured of both the vaccines, it will be around 8.5 crore doses per month. Remember the number. Before I break it up for you, let me tell you what Union Minister Gajendra Singh Shekhawat said on the country's vaccination drive. Trying to reassure citizens about the centre's vaccination drive, the minister said, and I quote, "We have been constantly working on increasing the production and availability of vaccines and will have each Indian vaccinated by December, which will be a huge record," unquote. Well, that is nearly 136 crore Indians, including the people who are already vaccinated. Achieving this by December will indeed be a feat if the government manages to do so. But will they be able to do it? To understand, we need to look at the current availability of doses and the number of doses being administered. Now, just a while ago, I told you to remember the number 8.5 crore. It is the current manufacturing capability of SII and Bharat Biotech. For a day, the total manufactured doses are around 27 lakhs. So what is the current rate at which vaccinations are being administered? For this, we need to look at the data provided in the CoWIN app portal. If we look at the numbers from May 1 to May 20, India was administering an average of nearly 16.4 lakh doses a day. So for the first 20 days, nearly 3.28 crore doses were being administered in the country. Now, if the vaccination rate goes at the same average for the remaining 11 days, the total doses that can be vaccinated will be around 4.8 crores. If we round it off to 5 crores per month, the question remains, where are the remaining 3.5 crore doses? The rate at which the vaccinations are being administered has also plummeted when compared to the beginning of the month. CoWIN data shows us that on May 10 and 11, nearly 25.7 and 24.3 lakh doses were administered respectively. Now, one important question that arises is, where are the remaining doses? While the states are reporting a vaccine shortage, the numbers indicate that the total doses manufactured were not administered completely. To discuss more on this, I am joined by public health expert Dr. Prashant Srinivas from Karnataka.
So, doctor, what could be the reasons for a failure to administer all the doses that are being manufactured right now?
Yeah, so I think the important thing is that we are thinking that vaccination is only a supply chain issue. Vaccination is actually more than just a matter of supply and demand. You know? So we have to look at vaccination as a complex social phenomenon. So on one hand, we have to be able to make local community health workers. In rural areas, there are primary health centers, there are ASHAs, ANMs. These are all together our main health workforce. These people need to be sufficiently involved in vaccination programs. If you look at India's previous experience, be it with pulse polio, be it with things like BCG and DPT, which happens at birth for almost every child, these people have enormous experience, wealth of experience, how to reach remote, all the pockets, convince people, etc. Unfortunately, with COVID, what we did is we completely reduced it to a matter of supply chains.
Okay.
So as if everything can be done at the central government, and then at some point we just send vaccines and then people will uncritically receive them. I think this is the crux of the problem. which we are facing now.
Okay. Now coming to a little more specific question, are there any faults in the current vaccination drive that you'd like to point out?
There is a big problem, and the problem is COVID. COVID is the biggest problem, I would say. See, initially the idea of having an app was for proper documentation of adverse effects following immunization. That is currently the reasoning being given why we went in for a centralized single app for vaccine delivery across the country.
Okay.
We have never done this before. So COVID for me is the biggest barrier for remote, rural, tribal and various other communities to be able to access vaccination. I think that's a big problem. Apart from COVID, secondly, we need to also be able to decentralize our vaccine delivery. So we need to have micro plans, and we have done this before. This is not new. If you ask public health people have spent decades improving vaccination coverage. So public health people like district health officers, ASHAs, immunization officers, if you ask them the first question, how do you improve vaccination? They will tell you, we need micro plans. Where do micro plans have to be made? They have to be made at ward level, at village level, at primary health center level, at taluka level, at multiple lower levels. So right now what's happening is instead of going for lower level decentralized micro plans, we are having state and national level plans. So I think it's very difficult.
Now, Doctor, from a public health expert point of view, what could be done to improve the vaccination drive in the country?
So one, we must move away from app-based vaccination to camp-based and campaign-based vaccinations.
Okay.
Yeah. Two, we must decentralize the planning and delivery of vaccines. We must have micro plans at lower levels, not at state and district levels, at lower levels. Three, we must improve community engagement about vaccines, the public engagement. There is still a lot of trust issues and hesitancy issues. We must rapidly address that, not in Twitter and in English-speaking communities on television. We need to do it in the community. We need to do it in meaningful ways where, tribal communities, migrants, rural poor and various others can connect and understand the issues about vaccines.
Well, the number clearly indicates that India is falling short on administering all the vaccine doses that are being manufactured. However, the transparency from the government on the administration of vaccine doses is still lacking. If you like this content, do give this video a big thumbs up and don't forget to subscribe to TV9 News on all the social media platforms. Thank you for watching and have a great day.